Hello, I want to talk to you today about reports included in the medical record. It is important to understand the different types of reports that may be included in a patient's medical record. These reports may include, but are not limited to, consultation report, history and physical, radiology, laboratory, pathology, admission, and discharge report. These reports and many other types of reports are some of the reports that may be included in a patient's medical record, and they may contain specific information about treatment and outcomes. It is important to review these reports so that you are familiar with what you might find in a patient's chart. So now let's discuss some of those reports. So now let's talk about the pathology report. A pathology report documents the examination of tissue which may have been removed, expelled, aborted, or may refer to the entire body. So let's say, for example, in the case of a patient who schedules a colonoscopy, you go to the facility, get your colonoscopy done, they find a lump, that lump is removed from your body and sent over to the pathology department for further examination. Later on, when those results are ready, it will come into your medical record as a pathology report. So if you are a patient looking at your medical records and you don't know where to look for those results, you want to look for the pathology report. Now let's discuss the anesthesia report. Procedures that require more than a local anesthetic require an anesthesia report. So for example, if a patient has been put to sleep during a procedure, there must be an anesthesia report. And on that anesthesia report, you will find any preoperative medications the patients may have been given, the time, the concentration, the effect the anesthesia had on the patient. So for example, if you threw up or had an allergic reaction, anything like that will be documented within that anesthesia report. The way that they administer the anesthesia, all of that information will be found in the anesthesia report. All right. And now let's talk about the registration record. The registration record, some people refer to as the face sheet or patient registration form. It depends, the facility or the health system that you are in. It will have different names. On this sheet, you will find your insurance information, of course, the patient's demographic information, and all of this is collected before the services are rendered to the patient. And now let's talk about the consent to treatment. The consent to treatment is another form of record that you will find in the patient's chart. So this consent to treatment is required for all treatment, of course, except in the case of an emergency situation. So in this consent to treatment is where the patient agrees to receive basic routine services, diagnostic procedures, medical care. Okay, so I think for now we're gonna stop there. Guys, as you know, I'm going to be doing these videos hopefully a little more frequent. Unfortunately, I haven't had time to do as much as I wanted to do, but I do plan on expanding on my videos. These videos are aimed at individuals that are either a patient, so mostly everyone. I bet most people have been a patient in their life, whether that was just at time of birth. But I do want to come back in here and try and help out as much as I can. So if you are looking to prepare for your RHIA examination and you want to learn more about other aspects of the test, please reach out, subscribe, let me know in the comments if you found this helpful. I sincerely hope you did. If you did, it really serves me as a great motivator to continue to do these videos, as unfortunately I am a little bit busy, and as much as I would like to build my YouTube channel, it is not realistic for me at this time. So sorry for the background. I know it's very lame, but I figure let me make sure that you have the information with you. It's more important to me than the presentation. But that's all I have, and I hope you found it helpful. Thank you for listening. Bye-bye.